Please welcome Wendy Cervantes, Director, Immigration and Immigrant Families at the Center for Law and Social Policy, in conversation with Dr. Kiara Alvarez, Bloomberg Assistant Professor of American Health at Johns Hopkins Bloomberg School of Public Health.
Wendy, thank you so much for joining us here today. We know that we have so many urgent policy priorities for immigrant youth. What are a few that you're focused on right now?
Well, let me just say, as someone who's worked at the intersection of immigration, children and youth and policy issues for well over 2 decades, and who did this work under the first Trump administration, I have never seen a policy agenda that so deeply and comprehensively undermines the health and well-being of children, youth, and families as the one I'm seeing unfold right now in this country. I mean, let's be clear, the systems that serve immigrant kids and families have always failed them and have always created barriers, but we are seeing the barriers exacerbated by the policies that are being implemented right now. In fact, the budget reconciliation bill that passed this past summer very specifically expands the restrictions, making it harder for even lawfully present immigrants, including refugees, to access basic health care and nutrition assistance. And that same budget reconciliation bill also quadrupled the budget of immigration and customs enforcement to really turbocharge the mass deportation machine that we have seen taking over the entire country, kidnapping parents. And I mean, really, while all the policies are harmful, it's the immigration enforcement that creates this climate of constant fear and anxiety that makes it scary to go to the doctor or to go to school. And that for the families that it's directly impacting, it's creating long-term devastating consequences.
Thank you for that context. It's sobering, but it's so important to know over the course of those decades, knowing that we've had a challenge, a system that's never worked in the best way possible for immigrant families, but that we're now at a point where it's so much worse. And I think as a mental health clinician, that aspect of the systems being actively harmful, they're not just obstructing good health and development for adolescents, but they're actively harmful, actively creating fear, trauma, and we've heard, a great keynote about adolescent development and the importance, right, of these supportive environments for development. And I think what we're really seeing on the mental health side is how damaging it is for youth to have to live in this environment of acute fear, not just of deportation, but of actual violence, of family members or possibly themselves being separated and not knowing where people are.
Yeah, absolutely. And the rhetoric is also so harmful. It's hurtful to hear people, much less our leaders, labeling parents as criminals, telling someone to go back to your own country, especially when that person was born here, or maybe this is the only country they've ever known. And, it's really, our young people in particular are also having to give up on their own dreams in many cases. Like in Florida and Texas, there are policies, they took away in-state tuition. So now being able to go to college is actually unaffordable now for many undocumented youth. And we are hearing parents making really difficult decisions, and in some cases choosing to leave their siblings in the care, the youngest children in the care of their oldest sibling. So we have immigrant youth, or in some cases they might be U.S. citizens, who are being delegated the responsibility, not only faced with the potential of losing a parent, but now having to forego college and figure out how to keep a job and raise young children.
And that's so important because here at the initiative, we focus so much on that transition to adulthood, on making that a positive transition. What are the resources youth need to survive? And we are really seeing that transition being halted or being changed dramatically, youth being expected to function as parents and also not be able to pursue their own dreams and goals. And I know we have fellows here from across the country, many of whom are working with families and working to figure out how to navigate this environment. You have so much experience working in large coalitions, really working towards progress in these areas. What are some things that you think we should be doing now?
Yeah, I've been fortunate to be able to build two really diverse coalitions, the Protecting Immigrant Families Coalition and the Children Thrive Action Network, both of which are made up of really diverse organizations, but also community-based organizations and service providers. And one has the mission of protecting access to healthcare for immigrant families, and the other is dedicated to children and immigrant families. And really what we've learned is that it's really important for people to see immigration as core to their mission, whether they're working on health justice, education justice, economic justice. And having these diverse networks allows us to get resources and information to providers and at the front line and community-based organizations that are working with immigrant families so that they can have some agency and some understanding of this rapidly changing policy environment and have the information they need to make the appropriate decisions for their families, and to engage young people in those decisions and to make sure that youth also get connected to the resources they need.
I love that as a closing message for us, the idea that immigration, supporting immigrant families, supporting immigrant youth can be part of the core mission of a range of organizations, and that bringing youth and individual voices to the forefront, community voices, is key to that success.
Absolutely. We all have a role to play.
Thank you so much for your work, and thank you for being here with us today.
Thanks for having me.